Hola, fellow Limeys. Christy from Happy and Healthy TV with you guys tonight. A very thunderstormy and rainy night. I hope you guys can't hear the boom, boom, boom going on in the background. Very hot. We would like to go stand outside in the rain right now. Anyway, today we're going to be filming a 100 Days of a Girl with Lyme documentary. Today is like day 33. And there's a couple of interesting things that are out in the news right now that I wanted to make my fellow Limeys aware of. A lot of controversy on Lyme over the past couple of weeks. I have to tell you, it's been very interesting to see the controversy going on. Not even controversy. It's, this is actually some justice for us. People are paying attention to what's going on for people in our population. So, two different points I'm going to make up tonight. One thing that we'll go through is some New York State legislature that is looking at long-term coverage for those who have Lyme disease and people getting treated on and on and on. So that being the case, let me go ahead and read these two articles to you. The first one, though, is pretty interesting, actually. You guys know that I'm not, how do I put this? I don't like to be an alarmist. That's just not my thing. Nor be a conspiracy theorist, because I back up everything that I say with research. So I found this to be a little interesting. Let me just actually click off of here because there is a ad on my computer that I don't want. Okay. This was published by rollcall.com. The House orders the Pentagon to say if it weaponized ticks and release them. So I had put a video out about this, about Lyme being biowarfare. There's been a lot of talk about this for quite a period of time. But there are people that are looking into this. This was posted on July 15th, so this is just a very recent article. This states here, the order requires the agency to say if it experimented with insects for use as a biological weapon between 1950 and 1975. And then below that it shows, awareness has grown since the disease carried by deer ticks, especially prevalent on Cape Cod and the islands, was first discovered in the late 1970s. More and more patients are being correctly diagnosed and treated with antibiotics to kill the bacteria before it does irreparable damage. Again, you guys know my case is weird because I was not diagnosed until 4 years after I was bit. So, bit twice. So we don't know what exactly the strains of Lyme disease that those ticks carried. So that's what makes it interesting. And a lot of people share that same issue, where people that didn't know they got bit by a tick. So it's interesting. Anyway, this goes on to say, the House quietly voted last week to require the Pentagon Inspector General to tell Congress whether the department experimented with weaponizing disease-carrying insects and whether they were released into the public realm, either accidentally or on purpose. We'll see what that says. The unusual proposal took form of an amendment that was adopted by voice vote on July 11th during the House debate on the fiscal 2020 defense authorization bill, which lawmakers passed the following day. The amendment by New Jersey Republican Christopher H. Smith says the Inspector General shall conduct a review of whether the Department of Defense experimented with ticks and other insects regarding use as a biological weapon between the years of 1950 and 1975. If the answer is yes, then the IG must provide the House and Senate Armed Services Committees with a report on the experiment scope and whether, quote, any ticks or insects used in such experiments were released outside of any laboratory by accident or by experimental design, end quote. The amendment is an attempt to confirm or deny reports that Pentagon researchers at places such as Fort Detrick in Maryland and Plum Island in New York, I could talk about Plum Island for a while, implanted diseases into ticks to learn about the effects of biological weapons and also looked into using insects to disseminate biological agents. President Richard Nixon banned U.S. government research into biological weapons in 1969, but research into protecting U.S. military personnel from such agents may have still continued, Smith said in an interview on Monday. A book called Bitten, which I have not yet read yet, but it's on my reading list, published this year, makes the case that the Defense Department research occurred and hints at a possible connection between the experiments and the spread of maladies such as Lyme disease, which is borne by ticks. To Smith and other advocates of the Pentagon IG report, studying the past may provide data that can stem the spread of Lyme disease in the future. That would be very cool. I don't want to see anybody else wind up sick. Between 300,000 and 427,000 new cases of Lyme disease occur each year, with further growth expected in the years ahead, said Smith, a founding co-chairman of the Congressional Lyme Disease Caucus. I don't have my glasses on, guys. Which advocates for greater awareness of the disease and for funding for research into a cure. We need more answers and we need them now, Smith said. Smith's amendment was co-sponsored by the Minnesota Democrat Colin C. Peterson, who is the House Caucus's other leader, and by Maryland Republican Andy Harris. Thank you, guys. Pat Smith, the president of the Lyme Disease Association, Pat Smith is awesome, said in an interview Monday that she is hopeful that the IG report could provide information that could save lives. That would be awesome. We need to find out if there is anything in this research that was supposedly done that could help us find information that is germane to patient health and combating the spread of disease, that she said. It remains to be seen whether Congress will send President Donald Trump a defense authorization bill with the weaponized ticks amendment. The Senate has passed its version without any similar provision, and now the House and Senate negotiators must reconcile the two bills. So I will go ahead and post a link to this article here. There are a lot of books out there by very credible physicians, authors, people who have suffered from Lyme. I myself have actually interviewed several people off the record from Plum Island and was pretty shocked at what I heard when it came to experimentation that was supposedly going on. Again, I can only do so much to confirm and or deny these things. However, just based on interviews, there's a lot of people concerned about that. So I'm glad that the there's a call to action to the government on this, and I think that should be the case. So we'll see if that had occurred. I do know that there have been a lot of reports from other people that have also stated this. And I guess it's interesting to see, what happened with this. I mean, I remember being a child and, there were signs saying, okay, there's a tick in the woods, be careful. But I feel like, I don't know if it's because I'm in this world and I deal with this day in, day out, and I see it more frequently. It's just one of those things. Or if it's something that's more prevalent today. I mean, it could be one or the other. Do I think that people have been experimenting on humans for a long time? I do. I do believe that based on quite a few things that are going on right now. And it's pretty interesting to see what's going on here. So that's one article that came up this week that I found to be interesting. And there's another one that I wanted to read to you guys. Let's see here. Let me pull this up. Okay, let me pop up here. And here's another one. LymeDisease.org put out an article, New York State to study question of insurance coverage for Lyme treatment. Okay, let's see what this one says. New York State Senator Pam Helming has announced that legislation she co-sponsored to review insurance coverage for the treatment of Lyme and tick-borne diseases has passed both the state and Senate unanimously. Yippee, that's good news. I have a question about that, though. Let's see if they answer this one in the article. As a member of the Senate Task Force on Lyme and tick-borne diseases, Senator Helming has been a strong advocate for those suffering from Lyme and tick-borne diseases and their loved ones who have fought for measures aimed at prevention, treatment, and awareness of these illnesses. Currently, health insurance companies are not required to cover long-term treatment for those who suffer from chronic Lyme and tick-borne diseases. This is a point I really want to make to people that really don't understand what the struggle is for somebody to be treated for Lyme. It's not covered under insurance, just like AIDS was not way back in the 80s. This bill, which is a Senate Bill 4571/A6146, calls for a study and report on the adequacy of insurance coverage. The data gained through the study will help lawmakers make informed decisions about insurance. Prevalent threat. Lyme and other tick-borne diseases continue to be a prevalent threat across our nation and around our state, excuse me, Senator Helming said. Since taking office as state senator, I have profoundly advocated on behalf of those suffering from these illnesses. I have to contact this woman, as well as other medical and public health professionals working with them. Those suffering from chronic Lyme and tick-borne diseases can experience serious symptoms such as extreme and long-term fatigue, nausea, depression, and joint pain. However, insurance coverage is insufficient when it comes to helping patients pay for the treatments related to these illnesses and their related symptoms. That can be devastating to people who are already battling these debilitating illnesses. This study will give us the data and the facts we need to address this problem. As state senator, I will be working with my colleagues on both sides of the aisle, as well as local grassroots organizations, to work towards better prevention, treatment, and awareness of Lyme and tick-borne diseases. This legislation is a major step forward in this regard, and I thank the State Assembly for supporting it as a bipartisan, unanimous manner. I'm hopeful that the governor will sign this into law soon. Fingers are crossed. Both sets. The legislation directs the New York Department of Financial Service in consultation with the Commissioner of the Department of Health to study and report upon the adequacy of insurance coverage for the treatment of Lyme disease and other tick-borne related illnesses. State of current coverage. The study will provide insight into the current state of insurance coverage as it relates to Lyme and tick-borne diseases and recommend solutions to ensure all New Yorkers are adequately protected. Many areas of New York suffer from high incidence of Lyme and other tick-borne diseases, yet insufficient insurance coverage impacts many seeking care. Rhode Island and Connecticut are among the states that have organized the toll these diseases take on victims by passing legislation that requires insurance to cover these diseases. Okay, my comment on this, and this had been mentioned by another Limey in one of our support groups. I thought this was really interesting, I have to say. Here's the case. Here's the deal. I belong to, I want to say, 6 Lyme disease support group forums, and I actively contribute to all of them, and also, seek advice from others at times, depending on what's going on in my situation. So I'm always trying to help people and or, provide assistance when I can, or provide knowledge. Most of the people that I know, and I was speaking to a fellow Limey last night, don't test as what we call CDC positive for Lyme, meaning that you need to have at least 5 bands on a test show up positive in order to be considered somebody who suffers from Lyme. Many of you guys know I've talked about this quite a few times. I only test positive for 3. They're all reactive bands. I have mycoplasma pneumonia and a whole bunch of other co-infections. So obviously I got bit by a tick that has affected me. As a practitioner, we're supposed to treat things clinically and then back it up with blood work. So my blood work is enough to back it up to say, okay, yes, this person has these symptoms, and yes, we should treat them. Here's the problem, though. There are still no clear-cut treatment protocols. Are they talking, and they don't specify what their insurance is supposed to cover. Is it antibiotic therapy, which some practitioners think works? Some practitioners believe you need to pulse. Is it natural therapy, which I can tell you as a nutritionist probably never will be covered because there's not a profit margin to be made there. We don't profit off of things that are naturally occurring in the environment, like supplements and things like that. And some of the experimental treatments, at least that I've done, are not actually even legal in the United States. However, it's interesting. There's a theory that, if you want to bring up the biological warfare theory again, there is a theory that Lyme was created actually way back in World War II as a defense mechanism to be used in Germany. Ironically enough, the treatments that I've taken that have worked for me actually come from Germany, so I always thought it was kind of strange that they seem to have not a cure, but, at least a treatment protocol that does work. So that's an interesting one. So yeah, that's the question. Do you have to test for 5 bands in order to be covered underneath this policy? Now, if you were not testing for 5 bands, or let's just say you do have Lyme disease and you're using a testing lab like IGeneX or something like that, and, LabCorp saying you don't have Lyme and IGeneX is saying yes, you do. There are over 100 different strains of Lyme bacterium at this point right now. This test is only looking at one. So if you come up positive with one, okay, great. And there's also 50% chance that you could have a false negative on those tests. So I think, hmm, for me as a practitioner, I think, well, one, reliable testing does exist. IGeneX is probably the most reliable. Could we get better? Of course, we could always improve that. I think that needs to be addressed. And then I would like to know, and I'll contact these senators on this and just ask them, do you have to test positive for more than 5 bands for this? Are co-infections included, and what are the appropriate and proper treatment protocols that are being set up that would be covered by insurance? My experience with dealing with health insurance, and this is nothing to say negative about anything, just my experience has been, I have never gotten better by insurance approved health treatment. What has always worked for me is always more holistically oriented treatments like chiro or acupuncture or nutrition therapy or just other things, you know, that would not per se be covered by insurance for the most part. So I find this to be interesting. Um, and that's a lot of people with Lyme. Again, as we always say, Lyme comes in different sizes, shapes, flavors. So it's interesting to see. I'm going to get some more information on this. Let me contact these senators and assembly people to find out exactly where this law is going. Curious to see what Representative Chris Smith from New Jersey comes up with in regard to, calling upon President Trump to take a look at this. I do know that President Trump passed a bill a while back. I have to go back and look at the research and the documentation specifically on that. The website escapes me at this moment. But it was talking about how people were looking into, or he wanted to have people treated in this country versus leaving to go to other countries for experimental treatment. I do know a lot of people with either Crohn's disease or with colitis or other significant health calamities like Lyme have left the country to go get treated. Quite a few of my colleagues who've suffered through different things like that have left, gone elsewhere, and have gotten better. So I know he had made a call upon the United States to, start having people treated here again. I have mixed reviews on that, to be quite frank with you. Not sure. Here's my problem. The United States, according to a WHO study done back in it's like 2010, they did a WHO study. We rank number 37 in terms of healthcare. So out of 40 industrialized nations. So we're pretty much on the bottom of the totem pole. Not sure if I want to be treated per se here or with therapies maybe in the United States. And again, no offense to the U.S., we do the best that we can here. There are certainly a lot of wonderful researchers and great people that are out there helping out. So I don't want to discredit that. I think you should have the freedom to go to another country if you want to get treated for something. Would it be fantastic if we could get treatments that were approved in other countries here in the U.S.? Of course. Why isn't everybody having conversations about this? I think that's very important to consider and something to look at. So anyway, just some food for thought for this evening. I hope that, some of this information is hopeful or helpful to you. Want to warn my fellow Limeys out there to please be careful in the heat this week. I know that it's been tough on a lot of people. I've been getting a lot of messages from people that they're stuck inside in the air conditioning. I myself have been just stuck in the pool with my son. We're not stuck in the pool. Very happily sitting in a pool, not wanting to leave it. Or in the ocean or somewhere where I can cool off. I can't seem to go outside unless I'm in one of those places. Thankfully, I live 5 minutes away from a beach and, I have a very nice pool in my backyard. So that being the case, please stay cool, guys. And I will go ahead and do some more research on this. I would like to talk to these senators and assembly personnel and find out where they are looking to go with these bills and what is going on with these investigations. It is very interesting. So I'm reporting to you about this tonight. Erin over at Health Nut News has reported on this as well. I thought that was pretty interesting. So go Erin at Health Nut. I had saw this article and then saw her article after it. I said, okay, let me, put a follow-up on this. So she was interested in looking at this too. Definitely got to get into interviewing that young lady. She's really just top of the line. That is Dr. Joseph Mercola. That is her partner there. So they're amazing, the two of them. Really just a powerhouse couple. So anyway, I hope that everybody has a good night or a great day from wherever you're coming to me from, and that this information was helpful and hopeful. It's at least moving in the right direction. People are paying attention, and I think that's a good thing. whether some things need to be fine-tuned or further clarified. That's left to be said at this point, which is obvious, that these things need to be clarified and fine-tuned perhaps, but it's a start, and a start is better than nothing. So I'm going to look at it from that positive perspective, as I always do. All right, everyone, take care. Love you guys. Good night.